When people hear the words blood cancer, they often think, can people really survive it? The truth is, many blood cancer patients today are living normal lives for years after they were diagnosed with blood cancer. In fact, some types of blood cancer now have survival rates above 90%. So what made the difference? Blood cancer develops when something goes wrong with the blood cells in our body. Doctors detect blood cancer through tests. There are exciting treatments for blood cancer that are giving patients more hope than ever before. In this video, we will look at the facts about blood cancer, including what causes blood cancer, how doctors diagnose blood cancer, and the treatment options for blood cancer, along with the breakthroughs that are changing lives around the world. However, before discussing the causes and treatment options for blood cancer, it is vital to know the exact nature of the disease. Blood cancer is a form of cancer, which means it develops in blood, bone marrow, or lymphatic system. These are the organs which have to do with the formation of blood cells or fighting off the infection. There are 3 forms of blood cancer, which include leukemia, lymphoma, and multiple myeloma. Leukemia impacts blood cells and bone marrow, while lymphoma originates in the lymphatic system that is an integral part of the immune system. Finally, multiple myeloma develops in plasma cells, which are white blood cells. Despite the fact that the above-listed forms develop in various organs, they influence the normal functioning and formation of the blood cells adversely. It explains why early detection and diagnostics are so vital in the process of treatment. One of the most common questions people ask is, what causes blood cancer? Doctors still don't know the exact cause of every case of blood cancer. However, researchers have found several factors that can raise a person's risk. One factor is long-term exposure to benzene, a chemical used in some industrial settings. Benzene can harm the DNA in blood-forming cells and raise the chance of developing certain types of leukemia. Another risk factor is previous chemotherapy or radiation therapy. Sometimes, people who were treated for another cancer may develop a secondary blood cancer years later. High-dose exposure to ionizing radiation can also increase the risk of leukemia by damaging bone marrow cells. Certain inherited genetic disorders, such as Down syndrome and Fanconi anemia, are also linked to a greater risk of developing leukemia. Additionally, a serious bone marrow disorder called myelodysplastic syndrome, or MDS, can sometimes turn into acute myeloid leukemia. But it's important to remember this. Having one or even several risk factors does not mean a person will definitely develop blood cancer. Many people with risk factors never develop cancer, while some patients get blood cancer without any known risk factors at all. So, if blood cancer can develop in different ways, how do doctors actually diagnose it? The process usually begins with a complete blood count, or CBC. This simple blood test measures red blood cells, white blood cells, and platelets. Abnormal results can sometimes indicate that something is wrong. If doctors suspect a blood cancer, they may recommend a bone marrow aspiration and biopsy. During this procedure, a small sample of bone marrow is taken and checked for cancer cells. To determine the specific type of blood cancer, specialists often use a test called flow cytometry. This technology looks at individual cells and helps doctors identify cancer more accurately. Doctors may also perform cytogenetic testing to search for chromosome abnormalities that are often connected to blood cancers. In recent years, next-generation sequencing, or NGS, has become a valuable tool. It can find genetic mutations that promote cancer growth and help doctors choose the best treatment options. Imaging tests such as CT scans and PET-CT scans may also be used to see if the cancer has spread to lymph nodes or other areas of the body. Interestingly, not every blood cancer patient needs a bone marrow biopsy. Some blood cancers can sometimes be diagnosed through blood tests and advanced genetic testing alone. The more accurately doctors identify the disease, the better they can customize treatment for each individual patient. Once blood cancer has been diagnosed, the next question is clear. What treatment options are available? The good news is that blood cancer treatment has improved significantly over the past few decades. One of the most important innovations is CAR T cell therapy. In this treatment, doctors collect a patient's immune cells, modify them in a lab, and then return them to the body. These modified cells are designed to find and fight cancer cells. Another major breakthrough is targeted therapy. Unlike traditional chemotherapy, targeted drugs focus on specific genetic changes that help cancer grow. This allows doctors to attack cancer cells more directly while protecting healthy cells. For some patients, bone marrow or stem cell transplantation remains one of the most effective treatment options. Modern transplant methods have improved a lot and can even assist patients without a perfectly matched donor. Depending on the type and stage of blood cancer, doctors may also use chemotherapy, immunotherapy, radiation therapy, or a mix of treatments. Today, treatment plans are becoming more personalized. By examining a patient's genetic profile, doctors can often choose therapies that provide the best chance for success. These medical advances are giving many patients more options and more hope than ever before. One question that every patient and their family members ask is, what are the chances of survival? The answer really depends on a lot of things. These include the kind of blood cancer, how old the patient's genetic changes, how early the disease is found, and how well it reacts to treatment. These days, survival rates are much better than they were decades ago. For kinds of lymphoma, about 77 out of 100 people survive for 5 years. For leukemia, it's 67 out of 100. For multiple myeloma, it's about 62 out of 100. It's really important to know that these numbers are just averages. They can't tell you exactly what will happen to one person. Some people do well with treatment and live for many years after they are diagnosed with blood cancer. One encouraging story is childhood acute lymphoblastic leukemia, or ALL. Because of treatments, most kids with ALL can now survive for a long time, over 90% in many countries. This means that most kids who get this disease can get better and live productive lives. These improvements happen because of diagnosis, better treatments, advanced stem cell transplants, and new treatments like CAR T cell therapy for blood cancer. Blood cancer is still a disease, but modern medicine has really changed the outlook for many patients around the world. What can we learn from all of this about blood cancer? Blood cancer is not always a disease now. Many people with leukemia, lymphoma, and multiple myeloma are getting better. Some are even getting cured. The important things that affect how well people do are finding the disease early, knowing exactly what type of blood cancer it is, getting the latest treatments, and seeing a doctor regularly. Doctors have a lot of ways to treat blood cancer because of genetic testing, special medicines that target the disease, CAR T cell therapy, and stem cell transplantation. Every person with blood cancer has a story, but one thing is for sure. The future of treating blood cancer is looking better than it ever has. If you liked this video, tell us what you thought. What is the surprising thing you learned about blood cancer today? Do not forget to subscribe to our channel for more videos about health and medicine that are based on facts and help you understand the latest medical discoveries.